Good morning, team. My name is Adelise Ramos, and I am a member of the management team for this unit. I have scheduled this meeting to talk about a recent incident that occurred on our floor. Being part of the management team, I have collaborated with my colleagues to discuss and evaluate this recent misunderstanding. As some of you may know, a fellow nurse exhibited substantial cultural insensitivity during her patient interaction, according to my observations. The nurse showed both a failure to recognize the patient's cultural background and a blatant disrespect for the core values and beliefs that make up the patient's identity. The nurse's behavior mirrors a systemic problem in healthcare, which underlines the necessity for cultural competency in patient treatments, according to a recent study by Stumble. Cultural competency is defined by having the capability to understand people from different cultures while communicating effectively and interacting with them successfully, as defined by the Centers of Disease Control and Prevention. This competency includes ability and understanding, along with attitudes which help people appreciate and respect cultural differences. The ability to create inclusive spaces relies heavily on this competency when applied within workplaces, educational institutes, and healthcare facilities such as ours. The recent interaction generates multiple issues, mainly because it could produce miscommunication and damage trust between the patients and healthcare providers. Study shows that patients who experience cultural incompetency from a healthcare provider can become frustrated and feel alienated due to the belief their needs and personal viewpoints are being ignored, as reported by a recent report on PubMed. Health disparity becomes worse, and patient care suffers when people choose not to seek medical help and follow treatment guidelines because they feel alienated or overlooked. The consequences of these interactions reach further than initial meeting and may influence our healthcare facilities' reputation. The provider experienced substantial consequences from this interaction as well. The nurse's conduct diminishes her professional reputation while potentially damaging her connections with both colleagues and the entire healthcare team. Study shows that providers who lack cultural competency experience higher stress levels and burnout because they find it difficult to establish connections with patients and effectively deliver care, as reported on a recent report by PubMed study. This insufficiency prevents the creation of collaboration and inclusive workplace, which results in diminishing quality of care for patients. These issues require resolutions to create a healthcare system that thrives on respect and understanding. I would like to take this moment to engage and see how we can move forward and learn from this experience. I add myself to the management members and engaging in discussions about the situation, because these conversations help build shared comprehension for both challenges and opportunities in creating an inclusive environment. Cultural competency forms a core of the operation philosophy and determines how we deliver care to our diverse patient population. Our organization must establish detailed policies and procedures to successfully improve cultural competency among staff members and patients, as suggested by the Substance Abuse and Mental Health Services agencies. Our policies must mandate training programs that develop cultural awareness and sensitivity alongside with communication skills that address our patients' demographic needs. We need to create explicit guidelines for staff interactions with patients that focus on cultural respect and personal care approaches. Staff performances, evaluations, and feedback systems need to be put in place to ensure the success of these programs and to ensure persistent advancement in our cultural competency efforts. I would like to take this moment and learn from this opportunity and see how we can improve in this new year and offer the best care possible to our community. Thank you for your time.